It was extremely painful. Kept me awake at night, couldn't walk on it.
Basically, it turned me into a 90-year-old person walking with a cane with daily throbbing of knee pain, popping way too much ibuprofen.
Arthritis is an extremely common problem, and the cause of arthritis is the joint wearing out. So the joint has this bone adjacent to another bone, and it's got cartilage which lubricates it so the joint can move. Because of the way people walk or their mechanics of walking or previous injuries or sports, the cartilage starts getting thinned out and starts wearing down. And once the bone starts touching the bone without cartilage, it starts hurting, and that's arthritis.
I was treating the pain with cortisone injections and ibuprofen.
Once I went to the orthopedic surgeon, he recommended that we just remove the remainder of my meniscus and just go bone to bone, take pain medications until I reached an age that was appropriate to put in a replacement knee.
Over 4.5 million Americans have had surgery for total knee replacements.
For decades, we've been treating arthritis the same way, either masking the symptoms or replacing the joint. And now we know that arthritis or degenerative joint disease is caused by the cartilage wearing out. The stem cells that were there when you're younger are just basically they're done, they're spent. So now we can get stem cells from another part of your body, say you're fat, put them into the joint, and actually get the joint to grow the cartilage back, reducing the pain and disability and getting people back to their normal life.
I came to stem cell therapy treatment based on the recovery time. There's been a lot of information on adult stem cells on the internet, and that's how I made my decision.
At work I had heard about the stem cell and that there was some promise to what it could do, and I thought, gee, I want to hang on to my knee as long as I can, and if this will do it, then why not?
We do a mini liposuction procedure on the abdomen or flank. We take a couple teaspoons of fat and we get 50 to 100 million stem cells. From there we process the cells, takes about an hour for processing, and we inject them back into the joint the same day. We use that with PRP, that's your own blood anti-inflammatory and healing factors, and hyaluronic acid, which is like a euflexa, which helps the stem cells stick to the joint where we want the cartilage to grow. Patients walk out of here the same day. We notice that the patients have an initial anti-inflammatory response, but really around 4 to 6 months is when the cartilage regrows and they're able to be more active, mobile, and have a better lifestyle.
Within a couple of weeks, my knees quit throbbing from pain and my flexibility increased.
After about 2 months, I noticed that the swelling seemed to be going down and just the overall pain was going away.
We were involved in a study with 1,200 patients. They were all bone-on-bone arthritis. There was at least a 95% success rate that they all had 50% improvement in their pain. Less than 2% went on to get a knee replacement. With that study, we checked an MRI around 4 to 6 months, and it showed that the joint space had improved. They also went in and did an arthroscope, and that indeed was cartilage that filled the space.
About 1.5 years ago, I had the stem cells done, and it's been fantastic. I would say I have about 90% of my mobility back.
For the last century or so, healthcare was about masking the symptoms of disease with drugs or with procedures. And now with regenerative medicine and stem cells, we have the ability to restore tissues, to actually grow back organs, and restore people's lives to the way it was before they developed disease. They can go on and live their life the way they want to, instead of the way they were forced to.
I basically had stem cell therapy 2.5 months ago. All I can say is it's changed my life. I do more after work, I do more around my house, and I can play with my kids.
Allure Medical is treating painful, arthritic knees with regenerative stem cell therapy. Using this breakthrough technology, Allure Medical combines stem cells taken from your own fat with growth factor-rich platelet from your blood to reverse arthritis, reduce pain, and improve function.
Stem cell research, the way we're talking about it now with restoring tissues and restoring organs, restoring joints, really been in the past decade, maybe 15 years. And the original stem cell studies were pretty promising. We could actually regrow cartilage. And right now we have studies about 7 years showing that people, even 7 years after getting their joints treated with stem cells, are still better than baseline. So they're really competing with the total joint replacement, but without all the cost and disability and complications associated with the surgery. And this is really changing the way we're approaching diseases. Stem cells are used for autoimmune diseases such as multiple sclerosis and Crohn's disease. It's used for spinal disease, for spinal injuries, for after strokes, heart attacks, heart failure. And certainly for joints, that was one of the original things studied because it was so easy to study, but it's really broad and expanding. So regenerative medicine is here to stay. It's going to actually replace typical or conventional healthcare.
I like the fact that I can walk around pain-free. I can go the whole day without having to rest. I can work. I can live.
I'm a functional father again. I'm playing with my kids. I'm helping my wife. It's changed my life. Unless you go through it, you don't know what a miracle it is.
While knees are the most common joints treated with stem cells, Allure Medical is exploring the benefits of treating additional arthritic joints, such as the shoulders, ankles, and even hands with this regenerative therapy.
Stem cell therapy is exciting. I've seen some amazing results. My patients are able to do the things they haven't been able to do: golf, play with their kids, and just live in less pain.
For patients that have things like arthritis and they felt they didn't have any choice besides going under the knife, besides having a surgery, stem cells have been nothing short of remarkable. We can actually grow the tissue back without removing the joint, without missing work, without taking time off, without physical therapy. They can get an injection of their own stem cells and grow their joints back. It's been remarkable.
Find out if stem cell therapy is right for you. Schedule a free consultation at alluremedical.com or call 800-577-2570. Allure Medical treats arthritic knees with regenerative stem cell therapy.
We can take stem cells out of your own fat, separate the stem cells out, inject them in your joint, and help your joint grow back.
With the stem cells, my life is pain-free. I can maneuver all day without pain.
What I love most is not popping a bunch of ibuprofen anymore, and I'm playing with my kids.
After stem cell treatment, our patients not only feel better, but their x-rays prove it that they look better.
Schedule a free consultation at alluremedical.com.